The last thing we will discuss are other hormones and chemical messengers within the body. We've already discussed a little bit about the atrial natriuretic peptide, or it's also known as natriuretic hormone, and how it is going to reduce blood pressure and blood volume and blood sodium concentration. It served as an antagonist to aldosterone. The other hormones that we are going to discuss are covered in our digestive system lecture. So they would be the gastrointestinal enteroendocrine cells. They will secrete gastrin that will stimulate the release of the hydrochloric acid. Remember, that was important in activating pepsinogen into pepsin. It will also secrete secretin, which will stimulate our liver and pancreas. And lastly, cholecystokinin will stimulate the pancreas, gallbladder, and hepatopancreatic sphincter. We've also mentioned a couple times now that our kidneys will secrete two hormones. We have erythropoietin, which will signal for the production of red blood cells. So once this hormone is released, we will get an increased amount of red blood cells that can carry oxygen. We also can recall that the kidneys will secrete renin. This is secreted in the area of the juxtaglomerular apparatus, which we will cover in our urinary system lecture. And it'll initiate the renin-angiotensin-aldosterone mechanism. The other organ that secretes a hormone is our skin. It is responsible for secreting cholecalciferol, and that is the precursor to vitamin D. And we've already discussed how important vitamin D is for calcium absorption. Our adipose tissue will also have its own hormone it'll secrete, and that is leptin. Leptin will help control our appetite and also stimulate increased energy expenditure. In our skeletal system lecture, we did not cover this hormone that is secreted by our osteoblasts, known as osteocalcin. It is going to be produced from the pancreatic beta cells, the same ones that secreted insulin, and it will improve the glucose handling and reducing of our body fat. Our thymus will secrete several hormones. It will secrete thymulin, thymopoietins, and thymosins. And they're involved in helping the development of our T lymphocytes, also known as T cells, within our immune response, which we'll go into more detail in Chapter 22. The last thing we'll discuss are developmental aspects. Our growth hormone levels are going to decline as we age, and this is going to account for the muscle atrophy that we'll see as we get older. Our thyroid hormones are also going to decline with age, which contributes to our lower basal metabolic rates, and our parathyroid hormone levels are going to stay pretty constant with our age, but as women, when we age, we are going to start to have a decrease in our estrogen, and that will make women more vulnerable to bone demineralizing effects of the parathyroid hormone.